the numbers that you shared regarding our testing, those are stunning numbers, and it reflects the hard work of the team and how you all have been able to navigate an array of hurdles and limitations while establishing these sites in Berkeley. And I think it's important, especially for our uninsured, people that may not be able to afford to get tested and get to locations. So this allows for good cases and contacts to be more quickly identified and followed by quarantine and isolation to limit the spread. So thank you so much for your hard work. It is truly, truly, truly welcome. So a couple of areas that I do want to give highlights to, Mr. Mayor, is number one, an update on our support for the unhoused community. And also I want to speak very briefly about our emergency information for the public around wildfires. And then we'll move to questions. I know we're limited maybe on time. So as you know, our EOC and city staff, they've been working hard to lower the risk of COVID-19 infection for the unhoused wherever they are. We've done a lot of team visits to encampments. We've set up trailers for a respite, identified those who really are medically vulnerable and could be housed in the county-run hotels and more. This week and last week, we were highlighting work to decrease the risk in shelters. So a lot of work has gone into that. The city and our partners, we've worked to decompress a number of our shelters, reducing their numbers. And what that means is that we move people to the county-run hotels or our respite sites. Each shelter now has is operating 24-hour shelters, and we've been visiting each one to review their COVID-19 protocols and confirm the maximum capacity required to minimize the transmission. This is a very important factor so that we can continue to limit the spread. As you know, earlier on in COVID response, there were a number of breakouts in homeless shelters in the Bay Area, and Berkeley has done pretty well to manage that. Also, staff use these vital visits to create an assessment. That's then reviewed by the health officer, and she has, I believe, signed off on Dorothy Day House snapshot last week, and the team visited Dwight Way Shelter, and they also approved the COVID-19 census for both the men and the women's shelters. So we're doing multiple things out there in terms of assessing folks and making sure that they're safe. Also, our respite sites and the hotels provide critical shelter indoors for almost all of the vulnerable. So as of today, all 69 rooms are occupied in the 2 Alameda County run Operation Safer Ground hotels in Berkeley. That's the Roadway Inn and the Quality Inn. Most of the residents in those hotels are Berkeley residents, I'm glad to say, and the result, this is clearly the result of some very hard work and patient work by our homeless outreach team and support from our advocates in our community. In addition, our EOC continues to support those staying at the trailers and house that in the home that encompasses our Berkeley respite sites, which have 12 out of 22 spaces occupied. We continue to look for our most vulnerable folks to fill those vacancies. And then lastly, around support for our unhoused, our Willard Pool has had a total of 235 clients that have used that for showers, and our West Campus has had a total of 154 clients. We're averaging about 22 clients a day at West Campus and about 34 people per day at Willard Pool. So that's pretty much it on our unhoused population. I also want to encourage our public to, again, sign up for AC Alert. I know it's a really important resource and it may be cumbersome signing up, but this is our dedicated emergency channel for people to reach people over text, phone, and email. So with our fire season fully underway, we want to make sure that those people that are living in the hills, that they use all of the city's references on wildfire evacuation page if you visit our website. That page guides residents through how to prepare their house for it in advance, what to do when a fire is threatening, and how to evacuate, and what to do when returning home. Those are critical must-knows. You need to know those things like the back of your hand. So the more individual homes that prepare, the better we're going to be able to respond and help those folks that are in need. So I'll stop there, turn it back over to you. I know there are a number of questions, so thank you.
Thank you so much, Madam City Manager. Okay, we're now going to turn to the questions that were submitted, and residents have the opportunity to submit questions for our panelists. I'm going to first go to questions that we will direct to the city manager. And the first question is around cooling centers. Locations where people can go to off the streets, when there are very hot temperatures. Where are the cooling centers that residents can go to if their homes are too hot or they don't have air conditioning? People used to go to the libraries, but that is no longer possible. Madam City Manager, I believe you're currently muted.
Sorry about that, Mr. Mayor, thank you. So yes, we used to have our libraries as a resource for our community to utilize, and unfortunately, those are not available at this time. Our shelters are open for anyone. So if, even our community members that would like to come to the shelter that's located downtown, and again, we've only had one, and it's our old City Hall location on MLK. And folks can certainly go there to that location to cool off. That's not just for our homeless community or people that are unsheltered. It is for anyone that needs to stop in and use it as a cooling center. What we do encourage, though, is for people to actually rely on neighbors and friends that are not exposed in a way that, especially locally, and if you can go to a neighboring jurisdiction or a friend or family members, that would be the most preferred. But again, our neighboring jurisdictions, the only other facility that had a cooling center was Oakland, that was very close to us. So we're limited as well. They had one for their entire city. So for us, I think, we have to do the best we can, but please, I would say plan early, use your personal resources like friends and family in Berkeley.
Okay. Thank you very much. We'll go to the next question, which is around fire safety. And this is certainly an issue that we've received a lot of phone calls and emails about the dangerous activities that are occurring on Grizzly Peak, including people lighting trash cans on fire and fireworks. This resident is asking, what actions are the city undertaking to address the dangerous activity that's occurring on Grizzly Peak near Tilden? Madam City Manager, again, you're muted.
Sorry about that. So, the jurisdiction that we're speaking of, clearly it's not in Berkeley. However, we feel just as responsible. The Berkeley Fire and Police Departments, we are coordinating with all of the surrounding agencies who have jurisdictions in the hills. This past weekend, our police departments, they coordinated patrols and enforcement of a 9 p.m. curfew, which curtailed significant dangerous behavior on Grizzly Peak. And those efforts will continue throughout the fire season. There are posted signage that our local jurisdictions have posted so that people will be aware that there's no parking and no gathering in those locations around the Grizzly Peak area. People have just decided to not comply with those rules. However, I think a 9 p.m. curfew with significant patrols and enforcement will deter the activities that you have been seeing. And so this is being coordinated jointly with East Bay Regional Parks District, Oakland PD, UC PD, Berkeley Fire and PD as well. Thank you.
Thank you very much. I know that there's been increased patrols off Grizzly Peak over the past several days. And, as you mentioned, we're working in coordination with all those agencies to address this very serious situation. So moving now to the next question, which is also about fire safety. This resident suggests it's time for the city to take action to prevent an Oakland Hills type disaster, and feels that trimming trees in city parks is not enough. It's not too late to begin working directly with East Bay Regional Parks Fire to see what practical things the city can do along the Parkland City interface. What actionable steps are being taken to follow up on the council's actions? And we talked a little bit about the prevalence of this very dangerous activity that's occurring up near on Grizzly Peak, but I think this resident's sort of asking broadly about the city's coordination with East Bay Regional Parks and other agencies to mitigate fire risk?
So yes, so thank you, Mr. Mayor. So yes, and thank you for you and the council both allocated hundreds of thousands of dollars in the last 2 years. That's gone to not only vegetation management and the removal of hazardous trees and fire zones. That work is being done in collaboration and in coordination with the fire department and our Parks, Recreation, and Waterfront department. And that funding has also gone to improve the conditions of paths to aid in evacuation should a fire occur. So Berkeley firefighters, they inspect, our department inspects over 600 properties annually in the hazardous fire zone, and they work with property owners to mitigate those dangerous fuel situations. We also participate in the Hills Emergency Forum. Now that's the collaborative group that was launched after the 1991 fire. And that group coordinates vegetation management, code enforcement, grant applications regionally. And the monthly meetings are being hosted by Berkeley this year. So I'll be sitting on those, hosting those meetings with our fire chief to coordinate those regular meetings. Also, East Bay Regional Parks District, UC Berkeley, and Oakland, they all do significant vegetation management in the areas immediately adjacent to Berkeley. So the North Orinda Fuel Break this is a grant funded project, and that has reduced hazardous vegetation in an area that protects Berkeley, El Cerrito, Kensington, Tilden Park, and Oakland. So the initial fuel reduction, that was completed last year, and the maintenance work continues for several years to come. I can't say enough about the coordination. All of these folks are coordinating, and I know that people may think that the fuel mitigation is only a singular part, but that is one of the largest and biggest components of making sure that we remain safe in our communities. So, and that's limiting and reducing the vegetation. And our partners and the city of Berkeley, we take that very seriously.
Thank you so very much. Another question relating to fire safety: are there emergency evacuation centers where residents in the hills can go to where there may be a fire or natural disaster? I know we have these care and shelter sites throughout our city, including at our senior centers and other community centers.
Right. So a fire location and that the behavior of a fire is just unpredictable. Evacuation routes and the destinations, those will be determined depending on the fire, the road, and the traffic conditions actually when a fire occurs. Now, before a fire, though, it's critical that residents and other Berkeleyans visit our wildfire evacuation webpage. That webpage is www.cityofberkeley.info/wildfire evacuation. Again, that's www.cityofberkeley.info/wildfire evacuation. You need to visit that location to get the resources you need to prepare for a fire. But again, that is determined at the time of a fire because it depends on where the fire is moving, the road, and traffic conditions. Now, there will be some critical information that you'll find on our website, and it will talk very detail about before a fire, how to prepare your household in advance, when the fire threatens, how to get ready to evacuate, and during a fire, how to evacuate. And then after a fire, when you're returning home. And all of these resources are available in English and in Spanish. And also, again, please sign up for our emergency alerts at www.cityofberkeley.info/AC alert. Thank you.
Thank you. There were a couple of questions around the encampments at Interstate 80 and University Avenue in Gilman, and just around the status of coordination with Caltrans to clean up those properties, given the large amount of debris that is existing there currently. So I guess I'll just kind of consolidate those questions and ask if you can give an update on the status of our efforts to work with Caltrans to clean up and improve the condition of those properties.
So Mayor, as you know, and very well, we've been working extremely hard with Caltrans and partners and advocates for months and months at this location. We've done a number of things from outreach to putting out garbage bins. Caltrans has been going out on a monthly basis to clear garbage and debris. Our advocates have been out there supporting our homeless community as well as the city and Lifelong, Dr. Hernandez's team. We've all been very supportive of our unhoused community, but things have just gotten so bad that we've got to do something drastically different to support them and to clean up our community. And what I envision that is, of course, we'll continue looking for outdoor shelter in the city of Berkeley. But in the meantime, we are going to be making a very strong coordinated effort with Caltrans over the next 30 days to clear the encampment area of garbage and debris and present an area for folks that can be a little cleaner and a little safer for them to be there. So our goal is to continue looking for an outdoor shelter location in our city, but also to address the blight and illegal dumping and all of the issues that are prevalent at the sites, Gilman and University, above and below the underpass. So this will be a huge step forward, I believe, but it won't be the final solution. We're just hoping that it will be a solution that will clean it up. So those are my comments at this time.
Thank you very much. We'll certainly keep the community updated about this effort. I think the goal is to try to resolve this within the next 30 days.
Yes.
Moving on to a question around childcare. This resident said in Cajon Valley near San Diego, they offered free emergency childcare for essential workers in April. It ran as an in-person summer enrichment program for more than 1/3 of its 17,000, mostly low-income students. What is the city doing to support low-income essential workers and their childcare needs? And before I go to you, we've had a lot of conversation with the Berkeley Unified School District about this over the past couple of months. And our Parks Department had a limited summer program, and we're in discussion with the school district around how we can expand access to childcare, particularly for essential workers and low-income families.
So, Mr. Mayor, we'll continue working in this area. I don't think that we are anywhere near what that jurisdiction has accomplished, but we do offer scholarships to families here locally, but there's just a great amount of undone work in this area. And I think that's a place where we've got to just do better to help our residents achieve child care support and services. But again, we do offer scholarships for different programs, and that's all that we're providing at this time, but we're continuing to look for alternatives and opportunities for folks.
Yeah, and I'll just acknowledge that we had a discussion about this at the 2x2 committee, which is a joint committee of the school board and the city council. And this will definitely be something we're continuing to work in partnership with the district on. And I know park staff, my staff, district staff have been meeting about this over the past several weeks.
There are a number of good ideas that came out of that, and we're going to be moving forward on some things. Thank you.
Yeah, and I know that one of the other issues we talked about, which I don't know if it's directly addressed in a question, is sort of the transition to in-person instruction. And there's a lot of factors that the district has to resolve, not including the public health order and the specific state and local requirements, testing. They need to work with staff, their teachers, and locations. And I know that a lot of parents have suggested the idea of using city parks or playgrounds as locations for outdoor instruction. And I know the school district is looking at that particular model as well.
Yes.
So I want to update the community about that. Swimming. First of all, our pools are open, which is great. Thank you. This resident had asked, why are the pools only open to lap swimmers and individual exercisers? Is there a way that exercise classes could be conducted as long as physical distancing is maintained?
Well, at this time, we're concretely following the health officer's orders in this regard. So at this time, that's not something that's allowed, but we will continue to look at that moving forward.
Thank you very much. And I'll acknowledge many of these questions are not directly COVID related. They're more sort of broader questions around city services and city policy. but I think I appreciate these questions and the opportunity to respond to them. One last question, not necessarily COVID related, but I know there's something that there is a great deal of interest and concern about, is around trees. And this resident's asking, why is the city cutting down trees when they're so important to climate and human health? I know that in Southeast Berkeley on Deacon Street, there was some tree work that was recently conducted. And as a result, neighbors in that neighborhood are very concerned about the maintenance of existing mature trees. And I know that our city staff are going to be working with neighbors around, consulting with them on any work around trees in that particular neighborhood. But if there's anything else you want to add around the tree issues in Southeast Berkeley that have arisen recently?
I just think that, when it comes to trees, and clearly a tree canopy is essential to, reducing the air quality issues that are happening in our city, and reducing the carbon footprint for our city. So we know how important trees are in the city, and we have an arborist that's very strong and very supportive. He's a tree advocate. So when you hear that a tree is coming down in Berkeley, that is not something that's done very lightly in our city. So unfortunately, we're going to see a few trees removed in our city, but we are also going to replace trees in our city, especially those that are not on city right of way and they're in a neighbor's yard or an owner's yard. If they're willing to replace their trees, we're going to replace those trees as well. We'll continue meeting with folks to address some of the tree removal issues that is still ongoing. We do have cleanup activities that are ongoing out there in the neighborhood where the trees were being removed. So this is a very sensitive subject for our city and our residents, and we understand it. But we do not remove trees unless there are significant reasons and or life-threatening reasons and or disease reasons for which a tree cannot sustain its life and it has run its course. So there are real reasons why we would have to remove a tree, and we would only do it under those circumstances.
Thank you very much. So I'm now going to direct the next set of questions to our health officer. The first question is around the curative pilot, which has been operating at the North Berkeley BART parking lot. And this resident just has nothing but positive things to say. It was a wonderful experience. They got the results in 24 hours and is asking, is there a plan to move the kiosk to another location or expand the program longer term?
I'm so happy that this individual had a great experience there. That's what I've heard from others as well. I haven't been to the drive-through yet. I did do testing when it was at San Pablo Park, and thought that the testing was very easy for multiple reasons, including the turnaround time, which is extremely important when it comes to disease control and people feeling reassured if their tests are negative. So it's really important that we have this service, and I'm really happy that others are having that same experience with the site. Right now, it's still a pilot, and as you mentioned, it is until early October. We're working with Curative and looking at other options and opportunities for making sure that we continue to have testing here in the city that is easy and convenient and has a good turnaround time, because that is, as I mentioned, and we've seen before, when we have those long turnaround times of 14 days, that is not going to be helpful for anyone. So I'm really happy that that person was had a great experience there, and we'll keep working to get either this site, either with a drive-through in another iteration, or similar services here in the city. Excellent.
Yeah, I've used it. It's great. It's quick. We get the results in 24 hours. This has also been really critical for us to not only expand the access to testing, but also, testing in parts of our city where, there may not be broader availability to testing, or to make testing available to communities that are maybe more disproportionately impacted by COVID-19. So for now, we have this pilot, and we're certainly exploring whether to continue that in the future. So next question is around indoor dining. And this resident sort of acknowledged that, San Francisco recently announced that they're going to be allowing limited indoor dining. And can you provide any information on the timelines for reopening indoor dining and what that might look like?
Sure. So San Francisco is allowed to do indoor dining because they are in tier 2 right now. So that's one of the triggers for allowing additional activities, one of which is the indoor dining. So when we move into tier 2, and that might be as early as tomorrow, we'll be looking at all the activities or sectors that are allowed to open, which includes indoor dining. And the indoor dining that's allowed is at 25% capacity or at 100 individuals, whatever is the lesser number. So that's to reduce the number of people that can have transmission and allow for physical distancing in those indoor settings. So that is something that we will consider once we're in tier 2. I don't have a deeper or a clearer timeline for this individual question.
Thank you very much. A couple of specific questions around when specific activities may be able to occur. One, why are nail and other personal care salons not able to open on the same schedule as hair salons? And 2, will I ever be able to get a facial or massage again? This individual's gift certificates are expiring. We certainly don't want those gift certificates to expire. So,
well, at least you still have yours. I had one from a great salon that one of my good friends gave me, and I lost it. So I'm glad you've held on to yours. So I'll answer that question first. Right now, facials and massages are allowed outdoors.
Outdoors, yeah.
So once we move into tier 2, there is ability for us to consider indoor with modifications for facials and massages. And if you look at our order for outdoor services, there are some additional restrictions in terms of making sure that the appointments are staggered to allow the salons to clean the facilities and the chairs for the services. So that's what I would imagine would happen once we do indoor services for facials and massages. But again, just like with restaurants, we're going to consider all of the sectors that are allowed in the next phase, and what and how we will be able to open them based on the risk here in the city, and again, in concert with Alameda County. The second question, or actually your first question about the nail salons, why are nail salons different than hair salons and barbers? There's 2 reasons. One is because the nature of the work. When someone's cutting my hair, they're behind me for the most of the time, and they're not touching my face or my mouth, and their face and mouth aren't near mine. So we've seen that it's the nature of the interaction. And the second, we've actually seen studies where I believe it was in Minnesota, where there are a couple case studies, case reports where hairstylists were actually COVID positive and cut over hundreds of individuals during their time when they were contagious, and there was not transmission. And these are 2 examples of seeing where the transmission wasn't the same as what we've seen in settings for nail salons, where there is, even though there is some distance for if you're getting a pedicure, you're not having that same distance with manicures. So we're looking at what we've seen for transmission, some of which is released in studies. Some of them are from our experience throughout the state, as well as what provisions and protections we can have for both the stylist or the manicurist and the person getting, the patron who's getting the services.
Thank you very much. There was a question, a specific question, this person's seeking guidance. What do you advise about attending an ice cream group social outside in a church parking lot?
That's a social gathering. That is not allowed right now, unless that's your social bubble and you've been, you're going to be in that cohort of 12, and you've decided to do it in a church parking lot. That is not an allowed activity. So that's what I would say to that. It's not permitted, and every activity that you do, whether it's permitted or not permitted, is increasing your risk of getting COVID. So you have to kind of look at what you're doing for the week, for the next few weeks, and kind of judge your risk and try to balance that. But this activity is not allowed.
Thank you very much. So there's a question about outdoor rock climbing. This resident says, other outdoor sports like pickleball and tennis have been available for months, and rock climbing is allowed in other jurisdictions.
Yeah, it's again the nature of the activity. Rock climbing, you're in contact with surfaces that other individuals will have had contact before you touched it, and then other people will come behind you, and there's no way of knowing if they're within the, if they're often not going to be in your cohorts. So again, you're increasing your risk with having contact with surfaces that may have been touched by someone who has had COVID, and then you may inadvertently touch your face, your nose, or your mouth, and then inadvertently infect yourself. So we're hoping one day to open activities a little broader, but right now, things with activities with contacts to surfaces that are having regular and contact with other individuals are not allowed at this time.
We sure do know how to take all the fun out of it, huh? I know that no kids and young people are looking at us like, really?
Well, now I have another question, which is around playgrounds, and currently play structures. So parks are open. You can use paths. You can use large parts of parks, but play structures and playgrounds are not currently open for similar reasons. And I know that a number of parents have been contacting the city recently, as kids need to socialize, and are hoping that the city will reevaluate when playgrounds will be open. And so, Dr. Hernandez, I want to ask you if you can address the issue of playgrounds.
It's very similar risk that I described with the rock climbing activity. The other issue here is that it also encourages social gatherings, and there's hard way to, or gathering socially. It's hard to kind of manage that in terms of making sure that people are physically distancing, whether they're the children playing or the parents or family members supervising. So that's another factor to it. Believe it or not, this is a hot topic throughout the Bay Area. We've been talking about it as a group of 7 health officers to try to see how to think through this very deeply, because we know that this is a concern for our communities, the communities that we serve. And the other thing I want to bring up is that we're talking about this activity and also thinking about opening schools and expanding in-person instruction. So those are two activities that would increase exposures and contacts with children. So that's the other thing that we're looking at is playgrounds versus in-person instruction for children. And we'd love to open both of them, but we're really kind of weighing the risk there. But thank you for these questions. We really do feel strongly about them as well, and we really would like to open both. But at this point, we're not open. We're not going to open them here in the city of Berkeley yet, but we're continuing to have those conversations not only with Alameda County, but the 5 other health officers in the Bay Area. So Berkeley, Alameda, and the rest of the cohort of the 7 Bay Area health officers. So thank you for that question. And I hope one day on this meeting, I could say, we're opening schools and you can play in the playground, but not yet.
Thank you so much. I'm going to answer the last set of questions, which are about our new poster campaign, Mask On and Move On. And this resident asked around the outcome expected from this outreach campaign. What information does this outreach program provide? Raising awareness of wearing face coverings is essential to reducing the spread of COVID-19. And this campaign is a visual reminder to wear a mask. And the more people that are reminded about this, the more likely they will wear a face covering. And I want to acknowledge that the wearing of face coverings has gone up in recent months. And I think generally our community has really done a good job of following that requirement. I know it's an adjustment because we are not used to wearing masks when we're outside. So I really want to express my appreciation to Berkeley residents for really taking very seriously the COVID pandemic and wearing face coverings as a way to control the spread of COVID-19, but there is always room for improvement. And so that's the idea behind this campaign is really to remind people that it's important that you wear a face covering in order for our community to move on from this pandemic and to allow our schools and our businesses to safely reopen, for people to get back to work. It is one way that we can do our part to help us get through this and to keep our community safe. So that's the goal. It's just a reminder about the importance and how this is one way that we can contribute for our community to get through COVID and to reopen our businesses, our schools, our community. And then lastly, there was a question on where can individuals pick up these new posters. And posters are located at a number of stores throughout the community, at Safeway and Andronico stores, at Mitieta Foods, at both Berkeley Bowls. Truett and White and Ashby Lumber also have signs you can pick up. Monterey Market, our Berkeley Natural Grocery, Star Market, and also signs are available at 2180 Milvia Street, our City Hall, and the Public Safety Building. So we're working to get signs out there more broadly, but at all the major grocery stores in Berkeley, for the most part, you can pick up signs, and we encourage you to pick them up and share them with your neighbors. Let's plaster the community with this message so that we're all reminded of the importance to mask on to move on. So I want to thank the artist team and our city manager and city staff for helping launch this campaign. We're looking at putting up banners as well in our commercial districts as well to remind our community. So those were all the questions for today. And I want to thank our community for participating and sending in your questions. And I specifically want to thank Dr. Hernandez and our city manager, who are working tirelessly to keep our community safe, for participating today. And I know our community really appreciates you making yourself available and having this dialogue. And I think it's actually very rare that a public health officer and a city manager have had this kind of transparency and communication with our community. So thank you very much. And before I turn it over to both of you for some final comments, I just want to once again remind the community to let's be vigilant. Once again, the fact that we are approaching 200,000 deaths in this country is a stark reminder of the critical need for us to to take very seriously the threat of COVID to all of us in our community. And so please shelter in place. And if you do need to go to work or conduct essential business, please wear a face covering. Please remember to wash your hands and practice physical distancing. This is critical to control the spread of the virus. And thank you to the many Berkeley residents that have been working to help us fight COVID and to support our businesses, to support our unhoused community, to support our students, and we'll get through this together. So with that, I want to turn it over to Dr. Hernandez if you have any final comments you'd like to share with the Berkeley community.
Yes, I'll echo your comments, Mr. Mayor, about thanking the community with generally abiding by the health officer orders, with sheltering in place, and wearing your face coverings when you're out in public. I know this has been a difficult time in terms of the duration of these restrictions and having to balance these public health measures that essentially have very invisible impacts, because many of us don't see the number of lives saved or the lives that are not infected, with the very visible impacts of the measures in terms of not being able to go to work as normally, or being able to move around society as we normally do. So I want to say that I'm really appreciative not only of the leadership here in the city, but also from the support from the community in terms of abiding by these public health measures, because they are making an impact for our neighbors, our region, and the state. So thank you again for your support.
Thank you, Dr. Hernandez. I want to turn the floor over to our city manager to ask if she has any final comments for the Berkeley community tonight.
Thank you, Mr. Mayor, and Dr. Hernandez, thank you so much. I don't know that we would have the results that we're seeing today without your leadership and your hard push to stay safe and healthy. So thank you. Mr. Mayor, you know, this is a wonderful venue, and I don't know that you get the thank yous and the kudos for the work that you do on a regular basis. You know, sometimes these are the jobs, and when you sit in these titles, these are the jobs where we don't get the thank yous that often, right? So I want to just personally thank you for your leadership in convening and making this happen every single other week. And for a while, I think we were weekly, right? So it's been a long haul. So thank you for your leadership. And to our Berkeley community, you're doing a great job. Please stay the course. Don't give up. I know it's been a long, hard journey, but stay with it. We are doing great here. And we'll continue providing our services as best we possibly can in our city. Things are running in our city. If you haven't been downtown to visit lately, it is a busy hub. Construction's going on, people are working, and we're trying to address some of the issues that face our community from our unhoused community. So we are trying to maintain a safe and healthy workforce, a safe and healthy community, and we thank you for your help and support with that. So have a good day. Thank you, Mr. Mayor.
Thank you so much. So thank you everyone for tuning in today. Thank you for your questions. We'll have another town hall in 2 weeks, so stay tuned for information on how to submit your questions and where to watch. And thank you once again to our public health officer and our city manager for participating. Please be safe and healthy and have a good evening.